Hello everyone. For over the next 10 minutes, we are going to talk about the route of drug administration. Simply put, route of drug administration is a path of drug takes to enter the body. You might wonder, why do we have so many ways to give medicine? Why not a pill? Why can't everything just be a pill? The answer comes down to the three main factors. One is speed, efficacy, and patient condition. If someone is having a severe allergic reaction, a pill takes too long to work. If a drug is destroyed by stomach acid, it can't be swallowed. And if a patient is unconscious, then they can't drink a liquid. In pharmacology, we broadly divide these these routes into two main categories. One is enteral route, which means going through the gut. Gut here is digestive tract, and through the parenteral route, which means bypassing the digestive tract. Okay, we also have topical and inhalation routes as well. Let's break these down and look at few examples. One of the thing is enteral routes through the GI tract. So let's start with the enteral routes. These are usually easiest and most common, and one of those is oral administration. So this is nothing but swallowing a pill, capsule or liquid. So it is safe, convenient, and usually cheapest option we can opt for. However, all the oral drugs have a major hurdle, that is liver. When you swallow a drug, it gets absorbed through the intestines and goes straight to the liver, which acts like a filter and breaks a lot of drug down before it reaches the rest of the body. So this is called as first pass metabolism. Example, standard painkillers that we use in our regular days, like ibuprofen and paracetamol. So coming to the next one, it is sublingual and buccal. Sublingual means placing a drug under your tongue, and buccal means placing it against the cheeks. So these tissues are here incredibly rich in blood vessels. The drug absorbs directly into the bloodstream, completely bypassing the stomach and the liver, so that there will be no any first pass metabolism. It's incredibly fast again. Example, the best example for sublingual route is nitroglycerin tablets that we use for chest pain. We call it as angina. Okay, it just gives the action within minutes. Next comes the rectal administration. Well, not always preferred by patients, because it is a bit discomfort for the patients to opt for the rectal one, but it is highly effective. It partially bypasses the liver, and it is a lifesaver when the patient is not moving, especially when the patient is unconscious, and when the patient have this vomiting feeling when the patient is not ready to take oral route. Okay, and when the patient is too young to swallow any tablet or any pills. Example, we can say diazepam suppositories. And next comes the parenteral routes. Parenteral routes, it just bypasses the GI tract. In clinical practice, this usually refers to injections, because these bypasses the digestive system entirely. They offer much great control over the exact dose compared to the oral route that enters the bloodstream, which we call it as bioavailability. Next comes, so we have different types of routes, in parenteral routes, that is intravenous, This is an injection that we give directly into the vein. The drug is delivered immediately into the bloodstream, meaning it is having 100% bioavailability. It is the fastest route possible, making it a gold standard for emergencies. Okay, the downside, once it's on, you can't take it back. Example, IV fluids for dehydration or emergency drugs like epinephrine during cardiac arrest. Next comes intramuscular route. This is an injection deeply we give into the muscle. Okay, muscle have a great blood supply, so absorption is quite fast, and it is slower than IV. Compared to IV, it is a bit slow, and the drug releases slowly over days and weeks. Examples, most vaccines like flu shot. And next comes the subcutaneous. This is an injection which we give into the fatty tissue just beneath the skin. We just give the injections beneath the skin. Okay, and the blood supply here is lower than the muscle. The drug absorbs slowly and steadily. Okay, next comes the example for subcutaneous is insulin for diabetic patients. Most of the people might have experienced this or must have seen this. There are elderly patients in our homes, right? Some of the people are taking these insulin injections. So these people opt for subcutaneous route. They just they just take the injection under the skin. Okay, they'll go for the subcutaneous route. Next, there are other routes as well. One of them is topical and inhalation. Finally, let's look at a couple of other crucial methods as well. Next comes the inhalation. This delivers drugs directly into the drugs. The lungs have a massive surface area and packed with blood vessels. This route can be used for a local effect right in the lungs and a rapid systemic effect across the whole body. Example for this might be albuterol. Inhalers used during asthma. The next one comes to topical and transdermal. Topical administration means applying the drug directly into the skin or mucous membranes for the local effect. Example, hydrocortisone cream for a rash. Then, however, we put the drug in a specialized patch, it can absorb through the skin and in the bloodstream for a systemic effect of over a long period. This is called transdermal route. Example, nicotine patches for quitting smoking. Okay, now coming to the conclusion, to wrap up, there is no single best route for drug administration. The ideal choice is balancing act between the chemical properties of the drug, how quickly we need to work, what is the emergency. Okay, based upon the emergency and the current condition of the patient, we have to choose the route of drug administration. And understanding these routes is a fundamental to ensuring the therapies are not only effective but safe and comfortable for the patients. So thank you for your time.